Welcome back to Previa podcast. It's Sarah
and Whitney.
Okay, so we're going to do, this is one of two series that's going to be aimed towards our pregnancy moms. And this is just educational more, but and it's good to just even hear it because you may be postpartum now and think like, oh my gosh, that was me. No one ever told me. So the first one we're doing is, yes, you can be depressed in pregnancy.
It's true.
Now, let's go back and say, what is depression?
Correct. So depression is going to be more along the lines of a lack of motivation. You can be feeling hopeless, like there is not a way out. Kind of imagine like you're almost down in this pit or in this well.
Yeah.
And you just look up around you and you think, I can't get out of this.
Right.
Like I'm going to die here.
Yeah.
Which I know that sounds very harsh. Depression can be harsh. And so I don't say that to discourage people. I say that as a reality. I do also want to put a clarifier out there that it is not inevitable for you to be depressed during pregnancy.
Right.
Just that it can occur prenatally. And we're going to be here to kind of talk about the risk factors, contributing factors for that, what that can look like, things of that nature.
And let's break it down too, as saying depression's not your fault.
Correct. Yes.
None of these mental health conditions are your fault. It's a medical condition.
It's like you didn't go out and seek it. You didn't choose to feel this way.
So this is, if you're saying, yes, this sounds like me, you did nothing to cause this.
Correct.
So let's just put the shame out the door here. And the sadness, the loss of enjoyment, of the hopelessness and being like, it takes over.
It does.
So it's not like something you can control it or wish it away. So let's get that out. So depression in pregnancy can be missed because they can be similar in their signs and symptoms.
That is true, because more so in the first trimester, but it can be in any trimester. You are going to have a decrease in your appetite because of the hormones.
Because you're throwing up. You don't feel like it. You don't want to eat.
That nausea is there. So depression, another one of kind of the textbook symptoms, is a loss of appetite or even sometimes like a loss of taste.
Right.
And
which,
so,
hello.
Yeah.
Pregnancy.
It changes everything.
So if someone's asking you that and you're like, yeah. They're like, oh, okay, because it's the hormones.
Yeah, so I could see where, a patient brings it up to their OB and they say, my appetite is just next to nothing, which really kind of bums me out. And the OB is probably going to say, well, you know what? You're 9 weeks. You're in the first trimester. That is not alarming to me. And then they may say, are you vomiting a lot? Are you able to drink things? Things of that nature. Right. They're going to make sure that you're getting some nutrients and some fluids to avoid dehydration. But otherwise, isolated, the appetite and lack thereof, an OB may not necessarily pick up on that being a red flag for depression, which the patient may not either.
Right. And then you have lack of sleep.
Yep, because everything's uncomfortable.
Okay, pregnancy, that can be all throughout that pregnancy.
And because of that fatigue, we almost have like that lack of motivation or that lack of drive that goes along with it.
Because you're so tired. You don't.
Exactly.
So it's all kind of messy there at libido.
Yeah.
You're throwing up.
Yeah.
Your body's changing. You don't feel like yourself. Third trimester, you're just like, don't touch me.
Yeah, get away from me.
So yeah, all those things.
Excessive or maybe spontaneous crying without a trigger that you can say, this is why I feel this way. Well, your OB may say, well, has anything happened in your life to cause you to feel that way? And you may say, no. They may say, well, again, you're 9 weeks. Your progesterone is really skyrocketing right now. It's your hormones. And again, that's true.
Right.
I can't say that that's not true.
No. So it's all kind of blurred lines.
It is.
And then you yourself don't know, okay, is this pregnancy or is this something more?
Exactly. So some other factors that I think are more depression as opposed to pregnancy would be you do find yourself withdrawing or isolating from people that you normally want to spend time with.
Friends or family.
Exactly. And there's not, again, a particular situation or something that was said that makes you want to back off.
So you're saying you're losing your normal support. You're not going to talk to him about it. And that's not a question probably that's going to be asked of you in the
Probably
OB
not.
office. So this is something that you need to know, and that your friends and family kind of need to be like, okay,
Yeah.
Whitney's kind of not herself.
She's withdrawing.
She's not wanting to engage with me. She's not attending what normally does.
Yeah. So those can be red flags, for people who are not pregnant, but hear this and you think, you know what? My friend that's, 25 weeks, they really haven't been coming as frequently, or they haven't been texting as often. Maybe I should check in on them and just kind of see how they're doing.
Yeah.
So that one I would think is a little bit more on the depression side as opposed to pregnancy. And at this point in time with COVID, we're not isolating. We're not hunkering down like we were 3 years ago. So that reason has kind of gone out the window. Now, that being said, it is still a really bad flu, RSV, COVID season.
So we get it.
So, if someone is like, hey, I'm newly pregnant, I did IVF to get pregnant, I'm not comfortable with a large gathering of people, that can be appropriate. That I can understand, and I would not attribute that to depression.
No.
If it's one of those, you're like, I'm really looking out to not get sick right now. Okay, fair enough. But then, a few months down the road when we get into spring and hopefully out of this terrible flu surge, and then we still see, no, I just don't really feel like it. No, thank you. And it's consistent.
So check on yourself and check in and say, well, why is it?
Yeah.
Or if loss of enjoyment of things.
Mm-hmm.
Okay, is it because you are an avid hiker and you're throwing up and you're just like, I don't want to hike anymore?
Yeah.
Is it because you physically have a limitation?
Yeah.
Versus you can and you just don't want to.
You want to.
Uh-huh.
And you just can't get it.
And you're just like, well, it's not happening.
Yeah.
So all those things you need to start turning into. And you may be hearing this and you're going, okay, I'm fixing to be pregnant. I'm pregnant. What are my, what's risk factors? So
I always tell everybody this is that if you've ever experienced depression, anxiety, OCD, bipolar, anything mental illness related prior in your life, you are at a greater risk for that prenatally and postpartum. Now, does that mean it is inevitable and a guarantee? Absolutely not.
No.
But it does mean that you need to be aware of what your depression looks like, what your anxiety looks like, because you know you the best.
Amen.
Because my anxiety may not present like yours, Sarah, and vice versa.
Right.
But we know, okay, well, when I really get anxious, this is what I tend to do, or this is how I tend to feel. So be aware of what your prior symptoms have looked like and felt like. Now, that being said, if you've never experienced depression, anxiety, any type of mental illness prior to your pregnancy, if there is anyone in your family that has had any type of family history, a diagnosis in the past, especially immediate family. So we're talking your biological parents, siblings, and even your grandparents. Okay. So those closer knit blood genes. Now, if you have a twice separated great uncle that has bipolar disorder, the genetics there are not as strong. So I wouldn't be like, I have it because they have it. I have it because something else.
Okay. So look at your own history, your own mental health history, your family's history, which is good to know. This is good to know our family history medically and mental health. If you have a history of physical or sexual abuse.
Any history of trauma.
If this pregnancy
was not planned. It was a surprise.
If you have a high-risk pregnancy, including your own or your child's medical issues.
So hyperemesis gravida, gestational diabetes, a history of preeclampsia,
placental problems.
History of HELLP syndrome. Those are big ones. Any major changes in your life, even if they are positive. So let's just say you got married or you moved into your dream house or
your dream job.
You got your dream job. Those are positive things. They are still stressors. They are still transitions in your life that you're adapting to while adapting to pregnancy.
That's a lot.
It is. And I will throw this out there too. Thyroid problems.
Yes.
I have hypothyroidism. And for the longest time, I never really knew why I had heart palpitations. Went to a cardiologist. They said, you have an arrhythmia. Be mindful of your caffeine intake. Okay, fine. Well, several years later, when I was dealing with infertility, guess what? I had a thyroid problem.
Yeah.
And while it has not resolved my anxiety completely, my anxiety is much better managed now that I'm on a thyroid medication.
Yeah.
So if you notice almost like a sudden onset and we don't have an external trigger for it.
Right. So we're not talking about a death, a loss.
Exactly. Or, losing your job or, any number of things or financial difficulties. We don't have an external source that we can say, this is why I feel this way. And all of a sudden you feel like you almost have a sudden onset of this. Get your OB to pull thyroid labs.
Just see what it is.
And most OBs do thyroid panels in pregnancy anyway. It never hurts to advocate for yourself and say, hey, can we pull those again?
Yeah.
Most OBs are going to be on board with that.
Yeah, because they want to know just as much as you do.
Well, and it's not unheard of to have a pregnancy-induced thyroid problem.
That's valid. So there is risk factors, right? There is things that can put you more at risk, but it doesn't mean you have them.
It's not inevitable.
It's something that just needs to it's like, okay, let's wake up a little bit.
Yep.
Let's put it on our radar.
Yes. Just be aware of those things.
Let's know our symptoms. Let's look more into them. Are they extreme? Are they past causes that we can name? Like, yes, I'm not eating as much because I'm throwing up. Or, no, I'm not throwing up and I still don't want to eat my favorite.
I have no desire.
Okay, so that's a thing. And people are now saying, okay, so what if I am depressed? What does that put me at risk for? Well, we know depression during pregnancy can lead to preterm babies, which now, that's a huge thing, is preterm birth, which we want to do everything we can to keep the baby in womb. And some things you could maybe saying, I had a preterm baby. Was I depressed? That's fault. No, it's not your fault.
No, not at all.
This is never saying that. This is knowing that what we can be aware of to try to help you.
But again, you think, if you're depressed and, nausea, vomiting, HG, those things aside.
You're not taking care of yourself.
Well, but also you may not be eating as much as you could or want to. And so you may have a lower birth weight baby sometimes.
That happens.
And that can also lead to preterm delivery. And so to those mamas who really struggle to have an appetite that is not nausea, vomiting based, think about drinking your calories instead of eating them. So protein shakes.
Yeah. Good smoothies. Put some peanut butter, avocado.
Smoothies, acai bowls are really good options.
Love those.
Do snacks instead of meals.
Because
you know what? A granola bar probably might sound better to you than an order of chicken nuggets from Chick-fil-A. Yeah. You may be like, I can't do that right now, but I could. Something small, maybe a little bit more carby.
Yeah.
Carbs are easier to digest.
Yeah.
And so play to your strengths. The path of least resistance right now.
And we know too, depression during pregnancy leads to higher odds of postpartum depression.
Absolutely.
And so what we're wanting you to do is look at this, look at your pregnancy, look at your symptoms, and know, let's figure out if there's something that you need help and support to. Because good news here, it's been really researched, been studied, therapy.
That's right.
Is a proven way that they can treat depression during pregnancy and postpartum.
That's right.
And let's say this again, if you need a medication,
that's okay.
That's fine. No shame.
There are researched safe medicines for pregnancy and breastfeeding.
So
throwing it out there.
We want you to know the biggest takeaway is know what is to be expected and not expected.
Correct.
And how to reach out for help. So how to help. If you're a Previa woman, you just email us.
Yes.
You hit your button
reach
on
out
the
to us
for therapy and we get you connected.
That's right.
Now, if not, Postpartum Support International, we've said this before.
I love them.
They are a great way. Having an open conversation with your provider and saying, I'm struggling because of this. Do you have any resources?
Exactly. What would you recommend?
And you can always, I would always say, and I told this to my patients, as a nurse, start early. The start of something feels off to you.
Absolutely.
Say it now because it's always earlier to intervene than it is once we've kind of reached this mountain. And we got all the way to go back down.
Absolutely.
So know that. Now, actually the U.S. Task Force recommends, which we follow this with Previa, that if you have these current risk factors, that you start therapy in pregnancy.
Absolutely.
So they recommend current signs and symptoms of depression, which we've talked about. So if you're showing this during pregnancy, they say, let's get you into therapy now.
Now's the time to get on board.
Which that's what we do with Previa, is because we know it works. History, like we said, of depression, that even if you have a history of that, they think you can benefit And it helps you so much to start.
Absolutely.
Even if you're not showing signs. Teen or single mom, low income, because we know that's going to put you at a harder disadvantage. Stressful life circumstance. Hello. Pregnancy alone could qualify for that. Yeah. And so they know therapy works.
Absolutely.
So if this is...
And I would think a lack of a support system too.
Oh, huge. Because you feel like you're alone and your therapist is going to give you validation, processing,
that's right,
coping techniques. So yes, depression in pregnancy happens.
Yes.
Yes, there's help. And yes, you do not have to always feel this way.
Correct.
And it is not your fault.
Yeah.
So
you don't have to live in misery.
No. And you're not a bad mom. You did nothing for this.
Correct.
And we want you to hear this and be aware. If none of this is, if you're like, okay, that's great. None of that fits me. Absolutely.
We know
that you're aware of it.
Yes.
And maybe you can use this information and be aware to help your friend.
Absolutely.
Or continue the conversation so that moms know we're not in this alone.
That's right.
All right, guys, stay tuned. We're going to cover anxiety in our next episode, and it's going to be great.
That's right. See ya.
Bye. Maternal mental health is as important as physical health. The Previa Alliance podcast was created for and by moms dealing with postpartum depression and all its variables like anxiety, anger, and even apathy. Hosted by CEO, founder Sarah Parkhurst, and licensed clinical social worker Whitney Gay, each episode focuses on specific issues relevant to pregnancy and postpartum. Join us and hear how other moms have overcome mental health challenges, as well as access tips and suggestions on dealing with your own challenges as moms. You can also browse our podcast library and listen to previous episodes at any time. Please know you're not alone on this journey. We're here to help.